I would like to start by wishing all Omanis a very happy 50th Omani National Day. It's a very special occasion and event in the hearts of all Omanis. And it's a day where we always remind ourselves of how proud we are of being Omanis and living in this beautiful country. The first Omani National Day celebration that I remember that comes to my mind was when I was in elementary school. The one that I really remember was a poetry recital play. Those days, the National Day celebration would involve also attending in the Royal Oman Police Stadium, a lot of carnivals and also military show. The National Day celebrations all through the years were actually steady, and it involved similar events. But towards the last decade, the high school or the school carnival did disappear. But the military show persisted, and the fireworks was an addition. It wasn't there at the beginning. But yeah, what really persisted from the 80s until now was the road decorations. So trauma surgery and being a trauma surgeon, does it affect my work-life balance? Well, it did for sure when I first arrived in 2007 from my scholarship abroad. Nobody has heard of trauma surgery in Oman. It was not a known specialty. I was the first trauma surgeon to arrive, followed later shortly by Dr. Abdul Harthi, my colleague. So it was very difficult to establish the trauma surgery concept and the trauma surgery service. So I had to be on call or on duty every day for 6 months, for the first 6 months. I attended every single trauma that came to the emergency department so that I needed to teach my colleagues and train them and establish the concept of trauma surgery principles in my hospital. Only then, after 6 months, and also after the arrival of my colleague, Dr. Abdul Harthi, things became much easier because everybody else was aware of what to do. So I didn't have to be there every day. Then we started going outside of SQ, outside of our hospital, to other hospitals, to other regions in the country, to continue the teaching and continue the training of other surgeons. In the last 50 years, the health care in Oman has really developed so well in many different aspects. One was the new buildings and the new hospitals, especially the regional hospitals that were built. In addition, the manpower and the investment in the Omani doctors really showed a major shift in the quality of healthcare delivery in Oman. We have a lot of Omanis who were sent abroad for training, and they, in the late 90s and early 2000s, they came back and they contributed so much in both training, education, as well as healthcare delivery. In addition, the establishment of the Oman Medical Specialty Board training, where we train Omani doctors locally here in Oman at a very high standards. That also improved the healthcare delivery in Oman. And now we're seeing the graduates of these of the local programs graduating very competently and taking leadership positions. So overall, it's been very, very positive and very remarkable improvement compared to the 80s and 90s. We need more trauma surgeons in Oman because trauma is a major problem in Oman because the people affected in trauma are the young, mainly the young generation. So this is the future of Oman, and if we don't know how to handle them, and if we don't treat them and handle them properly, that will eventually affect the community. I am very much a proponent of training more Omanis in the field of trauma surgery. My final message is again, wish you a very happy National Day. I hope that all of the Omani youngsters pay attention to their future and contribute to the future of the country by having a good education and coming back to Oman to educate the newer generation, as well as contributing to the workforce in the country. Only then that Oman will continue to flourish and continue to improve over the years.